Lords, I thank noble lords for staying with us for this very late on a Thursday debate. I know there are many noble lords, among them Baronesses Finlay and Brinton, movers of regret motions about the statutory instrument passed under the previous government that is behind the mess we are discussing today, who would very much like to have been taking part. Now, I'm not going to go over the same ground as on February 22, when I then begged the government to pause its action. But I will say that the concerns expressed then have only grown, reflecting many of the reasons why Professor Gillian Leng has been asked to conduct the review of PA and AA roles. In the words of the consultant Partha Carr, the government's national advisor on diabetes, we've seen months of heated debate, social media uproar, royal colleges in turmoil, and the reputations of many national organisations being questioned. Professor Carr has described this as, quote, the worst example of a policy implementation in the NHS I've seen, close quote. I note that just this week the Irish Medical Council concluded that it was not the appropriate body for regulating PAs. The council referred to, quote, the potential for emerging patient safety risks arising, as observed recently because of the regulation of PAs by the GMC in the UK. Now, I am going to ask a large number of questions, and to be fair to the noble lady the Minister, and hopefully to ensure that this debate is as constructive as possible, I have shared these with the noble lady in advance. I begin with the first part of my question, about the review itself. I've heard only respect and hopeful feelings about Professor Leng as lead, but many concerns have been expressed to me about the level of cooperation the review will receive and the quality of information available to it. I note that the GMC just yesterday, 9 days before it is due to begin registering PAs and AAs, wrote to medical bodies saying it would, quote, soon publish a report on the outcome of the consultation and research, along with the final drafts of the rules, standards and guidance, close quotes. Now, I note that just 2 hours ago, before this debate started, that was indeed published. Does the Minister consider that to be an appropriate timetable and level of transparency? Is the Minister happy with the response of the GMC to requests for information over this difficult year? Can a Minister assure me that Professor Leng will have the necessary resources and the government will do everything necessary to ensure she receives full cooperation and transparency? Now, we've seen many different, often disturbing, localised reports about the ways in which PAs in both hospital settings and general practice have been deployed. Knowledge and concern about the deployment of PAs and AAs is growing among patients and the general population. I note that the Fire Brigades Union conference back in May voted to oppose the growing use of PAs. Will Professor Leng have the resources to access those public views? Now, in terms of the review remit, it seems quite narrow. One obvious omission is the ask from the Royal College of Physicians that it should consider the impact of the PA role on training opportunities for resident doctors. Will the review be doing that? Further, will it consider the fundamental issue that the taskification of medicine is a massive change from previous practice and a reversal of the recent growing understanding of the need to consider the whole human and their environment in supporting health and tackling disease? Now, our debate in February heard considerable concerns about PA's impacts on doctors' training, and there were suggestions from all sides of the House that a major revamp of training arrangements for doctors needs to be put into place. Can the noble lady, the Minister, write to me about what plans the government might have in that area? But what I want to mostly focus on is what interim measures the government plans to deal with what is clearly an untenable current situation. Then Minister Markham in February said PAs and AAs had, quote, very much a supplemental role rather than a substitute, close quote. But that, of course, is not what's been happening, as was demonstrated by a letter sent in March by NHS England to ICBs and trusts, saying that PAs, quote, should not be used as replacement for doctors on rotas, close quote. Yet a detailed investigation by Channel 4 News in October found widespread subsequent use of such substitutions, and a number of trusts indicated that they did not even keep any records of such substitutions. Does the Minister stand by the NHS England guidance, and what will the government be doing to ensure that it is implemented? Now, the government announcement of the review says that it is to report in spring 2025. Now, Your Lordship House knows that the government definition of seasons means that can extend well into the year, and by the time the report is absorbed and action decided, realistically we're talking about a year of a clearly untenable situation. Interim action is surely needed. Does the Minister agree? Now, the Royal College of GPs governing UK Council in September voted to oppose a role for physician associates working in general practice. Reports suggest that PAs are, as a result, being made redundant, and my sympathy with them, and general practices subsequently are facing the risk of legal action as a result. How is the government going to deal with this situation and prevent it escalating at great cost to NHS services? The Royal College of Physicians Council has agreed that there is a limited role for physician associates working in secondary care in the medical specialities, as long as they are supported by clear supervision arrangements, professional regulation, and a nationally agreed scope of practice. Does the government agree, and will it take action immediately to deliver this, at least in an interim way? Does the government agree that supervision needs to be defined urgently? I come to care for our children, highly vulnerable patients at rapid risk of deterioration in condition, a particular area of concern. The Royal College of Paediatrics and Child Health has called for an immediate pause in the recruitment of PAs. Given particularly the very disturbing situation that arose at Alder Hey Hospital, does the Minister agree there should be such a pause? Now, the House might ask, where might guidelines across disciplines for national scope, a ceiling of practice for PAs and AAs come from? Well, I was at the launch of a detailed, carefully prepared British Medical Association outline of a PA-AA scope document, and I've not heard anybody express serious concerns about the activities of PAs and AAs being safe if they were working to that. Does the Minister agree? Now, later this month, very soon I think, it is expected that the Royal College of Physicians will publish a draft safe and effective practice guidance on the supervision of PAs, alongside a definition of the PA role that's been drafted by the RCP Resident Doctor Committee and agreed by the PA Oversight Group and the RCP Council. Does the Minister agree that this should be applied? Now, going back to our debate in February, I would suggest that the Minister misspoke then to say that the GMC is regulating. What is due to come into practice on December 13 is a registration process, and of course a process for which there is a 2-year lead-in period, so it will effectively remain voluntary until December 2026. Without a national scope and clear guidelines for supervision, this, I would respectfully suggest, cannot in any way be described as regulation. It is purely registration. Would the Minister agree? Now, I turn specifically to AAs and an issue that's recently been raised with me of grave concern, including legal concern. In the current regulations, AAs and PAs are not allowed to prescribe or order ionising radiation. But how can someone acting as an anaesthetist not do so? Expert advice I have received suggests that the tool of the patient-specific directive, which is meant to allow a doctor to direct another professional to make limited choice of drugs under very specific circumstances, is being used and possibly misused. I am told that PSDs are being used to provide an extensive list of drugs for AAs to choose from, essentially meaning they are prescribing. Can the Minister comment on that? Finally, I turn to a couple of further, broader what now questions. The NHS Careers website PAAA page, consulted yesterday, lists 39 universities offering courses for these roles. I've heard that several are pausing these courses. Does the Minister think it is fair for students to be encouraged to start new PA and AA courses given the uncertainty while the review is being conducted. Now, I want to conclude by stressing that my questions to the Minister, my concerns and the mess that we are in now, is not the fault of PAs and AAs, who in good faith have signed up for service, studied and got the debt to show for it. Can a Minister assure me that the Government is committed to ensuring that a way forward is going to be found for them, whatever the review's conclusions and future steps?